Hello guys, today I will discuss about bronchiectasis and cystic fibrosis. Bronchiectasis, it's usually sequelae of different diseases. Recurrent inflammation of bronchi, it leads to permanent dilatation of bronchi, and when the bronchi they get dilated, then there is further infections. So it is a vicious circle. Causes of bronchiectasis, of course, infection that can be acquired like pneumonia and tuberculosis, and it can be congenital because of immunoglobulin deficiencies like hypogammaglobulinemia, immotile cilia syndrome like Cartagner syndrome, in which we have got situs inversus, means that viscera they are on the opposite side. For example, if heart is on the left, it is on the right, and all the viscera they are on the opposite side in infertility. Then any malignancy, any foreign body, and cystic fibrosis in which there are thick secretions, they can also lead to permanent dilatation of bronchi. Symptoms and signs of bronchiectasis is of course breathlessness, fever, productive cough, and there's a copious amount of sputum, hemoptysis sometimes, use of accessory muscles, clubbing, and if bronchiectasis is severe, it can lead to right heart failure. Like it can produce symptoms like raised HAVP, loud P2, and parasternal heave and pedal edema. And clubbing, of course, can also be present in bronchiectasis. So, what is the treatment and investigations of bronchiectasis? First of all, we do X-ray chest, and in X-ray, we just got bilateral reticulonodular infiltrates, and obviously this infiltrate it can occur in many other diseases. So history, if it is leading towards bronchiectasis, like patient is producing copious amount of sputum and he has got previous history of tuberculosis or any other lung infection or malignancy, then we go to the next step. So this is the X-ray which is showing reticulonodular shadowing. HRCT chest, high resolution CT chest, is the investigation of choice. Here you can see that there is cystic dilatation of bronchi in both the lungs. This is another CT which is again showing cystic dilatation on one lung, and after that we can do sputum culture, and the most common organisms are usually Haemophilus influenza and Pseudomonas. So treatment is basically aimed by giving bronchodilator, short-acting bronchodilator like Ventolin, which is salbutamol, IV fluid, so that secretions they can be easily secreted and they get liquefied, and then broad spectrum IV antibiotic. Postural drainage means that the portion of the lung which is involved is kept on the upper side, and the other portion is kept on the lower side, and just physiotherapy. Then another disease which is cystic fibrosis, which is a cause of bronchiectasis, which is an autosomal recessive condition where there is defect in chloride channel, and there is a defective transfer of salt and water across the cell that leads to thick secretion, and thick secretion when it is in the bronchi, it leads to bronchiectasis. When it is in the pancreas, it leads to pancreatitis and malabsorption and steatorrhea, infertility, nasal polyps, and arthralgias. Treatment of cystic fibrosis, of course, medications. Again, we can give symptomatic management like bronchodilators, IV antibiotic if there is infection, and then we can also give some gene therapy like cystic fibrosis transmembrane regulator genes, but this treatment is obviously very expensive, and along with short-acting beta agonists, we can also offer patient physiotherapy and proper nutrition and IV fluids. Thank you very much.